Excellency Sika Kabore, Première Dame de la République du Burkina Faso, Excellency Tsepo Motsepe, First Lady of the Republic of South Africa, Excellency Neo Masisi, First Lady of the Republic of Botswana, and of course Dr. Tedros, Director General of the World Health Organization, Excellencies, Ambassadors, dear engaged partners, dedicated activists, allies, and friends, ladies and gentlemen, good morning, good afternoon, good evening. Thank you, Dr. Tedros, for reminding us that we have people following us from different time zones. I'm honored to be here today, 1 year into our commitment to implement a global strategy to accelerate the elimination of cervical cancer as a public health problem. Fighting a crisis amidst another crisis is no easy feat. I commend the WHO for not pushing women, particularly those from the developing world, to the side as it weathers the storm of the COVID pandemic. By placing concerns for people of both genders and of all races and ages at the heart of medicine, the WHO has made commendable headway in devising a permanent solution to the cervical cancer emergency. Distinguished guests, we all know that early detection is by far the most effective method of waning the fatality of cervical cancer. Mass screenings are essential to our mission, therefore, they should be considered an extension of the human right to the highest attainable standard of life and health conducive to living a life in dignity. Since the introduction of cervical cancer screenings in Rwanda in 2015, over 170,000 women have been examined. I'm confident that by this time next year, new partnerships will have helped raise this number further and will speak to the force of our momentum. Valued partners, devoted activists, allies, and friends, as the conversation between nations shift to include vaccine manufacturing and benevolent research, I hope that this spike in international health consciousness multiplies global resolutions to make cervical cancer prevention accessible to all. Rwanda has already surpassed the target set by WHO cervical cancer elimination strategy of having 90% of girls under 15 fully vaccinated for HPV. In fact, since 2011, our immunization of young girls aged 12 has consistently stood above 90%. However, research has emerged in favor of also inoculating young boys against the virus in order to reduce transmission rates. Therefore, our developing nations need to be equipped to double our efforts in the enrolling of vaccines. I join Dr. Tedros in inviting industries, the private sector, researchers, and development partners to work with our governments to reduce the price of HPV vaccines, HPV DNA tests, and the adoption of innovative technologies such as the WHO's AI visual examination tools. I hope for an African continent where these vaccines are produced locally with the support of our every ally who I believe shares our vision of health autonomy for all nations. To our women stakeholders, caring for your health must not be a periodic trend. The testimonies of survivors must be consistently amplified. We owe them the promise that their suffering is not the fate that we are allowing for the next generation of women. We owe the family of Henrietta Lacks the faith that the research that we are indebted to her for will lead us to a world with zero cervical cancer fatality. Ladies and gentlemen, a goal of such scale requires ambition from both genders. We owe that this goal cannot be attained with the burden fully resting on women. I again call on our male counterparts to proactively join this fight. This is true allyship in action, sharing our burden to alleviate the load of women as they strive for change that will benefit our entire societies. I thank you, and to more years of commitment partnership.